When trauma or disease cause the loss of a tooth in an aesthetic zone, the effects on a person's well-being can be more than psychological. Teeth may shift and move adjacent to the space due to forces generated during chewing, grinding, or clenching. Fortunately, there are several options to replace the missing tooth. One such option is a non-removable, custom-made ceramic bridge that is held in place using the teeth on either side of the missing tooth. Teeth on either side of the missing tooth are prepared. An impression is taken of the prepared teeth and surrounding areas, and a temporary bridge is placed to replace the missing tooth. The impression is then sent to a dental laboratory for custom fabrication and shading of the final bridge. The new bridge, with no metal showing, is then ready for the second appointment for installation. After the temporary bridge is removed and underlying supporting teeth are cleaned and prepared with a bonding agent, a resin cement is added to the inside of the bridge and seated onto the prepared teeth. After some setting of the cement, excess cement is removed from around the margins of the bridge. The patient is now ready to smile and function with a cosmetically pleasing final result.